Hello everyone and welcome to my channel. Today we will be talking about the ultrasound of the dorsal compartment of the wrist joint. So before we go into the sonoanatomy, let's have a look at the anatomy. So when you look at the dorsal distal end of the radius, so this is the radial side and that is the ulnar side. So when you are looking at the distal end of the radius, you're going to have a projection downwards. This we call it as radial styloid process. And from the radial styloid process, if you are moving towards the ulnar side, you're going to have a bumpy thing, and we call it as Lister tubercle. This is very important because when you will be learning the compartments, you will understand that Lister tubercle is the one which separates the compartment 2 from the compartment 3. And as you move towards the ulnar side, you're going to have the dorsal distal radio-ulnar joint. And further movement towards the ulnar side, you are going to have the ulnar styloid process. So remember, it is the radial styloid process. Then you need to know the Lister tubercle, then the dorsal distal radio-ulnar joint, and finally, you're going to have the ulnar styloid process. And if you go further, you're going to have a groove, okay, in the lower end where you will be seeing the Extensor Carpi Ulnaris tendon. Now, when we look at this dorsal distal end of the radius and the ulna, we have lots of tendons, which will be going for our fingers. So, and of course, our thumb. What usually happens is if we are not going to, separate them into different compartments. So what is going to happen is whenever we will be doing the extension of the wrist joint, we are going to end up in having the bowing up of the tendons. So what has been created inside our body is an extensor retinaculum. So this extensor retinaculum, it is basically a 2 centimeter width, a retinaculum, which will be extending from the radial styloid process, and it goes up to your triquetrum and the pisiform bone. So it's in an oblique manner. So this retinaculum sends septae, and these septae will be going up to the dorsal aspect of the radius and the ulna, and they will be converting this whole thing into the separate compartments. I always give an example, like there is a flyover and you have all the trucks, the scooters, the jeeps, cars, they are just running haphazardly. But if you're going to have different pillars, which will be separating this, then the movement of the traffic is going to be much easier. That is how this compartment, will work. So very easy way, if you just see this slide, it's very easy to understand the different compartments. So if, as I have told you, that Lister tubercle is very important, right? The bumpy thing which was present on the dorsal aspect of the distal radius. So if this is your radial side and that is your ulnar side, and Lister tubercle is the one which we are right now concentrating on. So this Lister tubercle will be separating the compartment 2 from the compartment 3. So if I'm going to move from the Lister tubercle towards the radial side, I will be seeing the compartment 2 first and then followed by the compartment 1. And if I'm going to move from the Lister tubercle, if I'm moving towards the ulnar side, I'll be seeing the 3rd compartment, then the 4th, then the 5th, and then the 6th compartment. Now, again, a tip from my side to remember is if you go for this, the odd numbers, that is 1 and 3. So this 1 and 3 compartment is for your thumb. Okay. Now, since this is the 4th compartment, so the 4th compartment is having the 4 tendons for the 4 fingers. Okay. Along with one extra, I should say the tendon, which will be coming in a while. And this 5th and 6th compartment is basically for the little finger. So 1st and 3rd is for the thumb, and 5th and 6th is for the little finger, and the compartment 4 harbors 4 tendons plus 1 additional, and this is for your I should say the 4 tendons are for your 4 fingers, and one extra tendon which was there, it goes to your index finger. Now, the compartment second tendons will be getting attached on the base of the second and third metacarpal. Now, if you want to remember the tendon names, let us understand this first, and we'll come back to the previous slide in a while. Always remember, whenever you are learning the tendons, it is always a longus, which is followed by a brevis, then a longus, followed by a brevis, and then, of course, a longus, right? So if I'm starting from the radial side, going to the ulnar side, you can follow the same. You can come from the ulnar side and you can go up to the radial side. So that is the listed tubercle. So if I'm moving from the radial side towards the ulnar side, I have a longus, and this longus is followed by a brevis. Then I have a longus. This is followed by a brevis. Then I have a longus. Same way you can move from the ulnar. So longus, brevis, and then longus. Now, what is important is, if this is the listed tubercle, you just remember one tendon. Okay. So on the third tendon, you have a longus. And since this is the extensor compartment, so the name of all the tendons, it is going to be the extensor, right? So this extensor word will be there for all the tendons. Now there is a rule. One tendon is going to be the alien one, and this will be the radial most tendon. So everything is extensor except one tendon, which is an alien. Okay. Then we have already discussed that first and third is for the thumb, and fifth and sixth is for the little finger. Now we'll go back to our previous slide. In addition to that, before going to the previous slide, in addition to that, we have also learned this formula: longus brevis, and then longus. So let us now go back to this slide, and it becomes very easy now for us to understand now. So everything is extensor, right? Everything is extensor except the one, that is this one. This is an alien tendon. Now this is for thumb, little finger, and little finger. That is also clear. Okay. And there is a longus followed by brevis, longus, brevis, longus. Now you're just trying to remember them with the name. So first compartment, you have Abductor Pollicis Longus along with Extensor Pollicis Brevis. So pollicis, we say it for thumb. So we know this was the compartment. Everything is extensor except the one which is an alien. So it becomes easy to understand that there are 2 tendons which are in the first compartment, and the name of those tendons is Abductor Pollicis Longus and Extensor Pollicis Brevis. Then you move to the second compartment. You already know this rule: longus, brevis, and extensor. So this compartment tendon is Extensor Carpi Radialis Longus and Extensor Carpi Radialis Brevis. When you go to the third compartment, the extensor rules holds true. Longus is also there. And we know that this is for thumb. So thumb is pollicis. So the name of this tendon is Extensor Pollicis Longus. Now we have in this compartment, fourth compartment, we have, the tendons for the 4 digits. So it becomes Extensor Digitorum, right? And another plus additional 1. So that is Extensor Indices, and it goes to the index finger. Compartment 5th, we have Extensor Digiti Minimi, and compartment 6th, we have Extensor Carpi Ulnaris. So let us revise these tendons once again. Compartment 1, we have Abductor Pollicis Longus and Extensor Pollicis Brevis. Compartment 2, we have Extensor Carpi Radialis Longus and Brevis. Compartment 3, we have Extensor Pollicis Longus. Compartment 4, we have Extensor Digitorum and Indices. Compartment 5th, we have Extensor Digiti Minimi. And compartment 6, we have Extensor Carpi Ulnaris. Now, this is just the tendon of first compartment. Again, we are just revising. So that is Abductor Pollicis and Extensor Pollicis Brevis. So these 2, they are coming from the ulnar side, and then they are just going towards the thumb. So in my subsequent videos, we will be talking about the proximal intersection and the distal intersection. So in that time, this will be important to understand that these are the two tendons. They're coming from the ulnar side. They're going towards the radial side. Now, if you see the tendons of the second compartment, they are ECRL and ECRB. They are coming from the radial side, and then they are moving towards our second and third finger. Then to the compartment third, that is Extensor Pollicis Longus. This also comes from the ulnar side, and it has to travel and go, and it attaches to the base of the distal phalanx of your great toe. So that is compartment 3. Now compartment 4, we have Extensor Digitorum, right? It is sending 4 tendons, which you can see for the 4 fingers. Along with that, we have Extensor Indices that goes to the index finger. Then the 5th compartment, we have Extensor Digiti Minimi, which you can see that it is getting attached on the base of the distal phalanx of the little finger. And you have Extensor Carpi Ulnaris, which attaches to the base of the 5th metacarpal. So that was all about the tendons. And let us now see the demonstration of all this anatomy. So now, if you want to scan the dorsal compartment of the wrist, what you are supposed to do is you make the patient sit, this is a table, you make the patient sit across the table. Elbow is in extended position, forearm is pronated, and palm is resting on the table. So that is the position which you need to keep if you want to scan the dorsal compartment of the wrist. Second thing is, which I always say, that you go for the palpation and then you put your probe, then it becomes very easy for you to examine the structures, right? So what you are supposed to do is, first you just start palpating this. This is the radius, right? Because this is the radial side, you have the radius here, you have the ulna on this side. So if you keep on palpating, the radius, you will see that there is a point, it comes when my finger is dipping and there is no more bone which I'm able to proceed, right? So this is the radial styloid process. And from there, if I'm going towards the ulnar side, I will be able to see a bumpy thing there. And this bumpy thing is the Lister tubercle. Now, as you have listened to the anatomy and you know that Lister tubercle is very important for us, because this is the one which will be separating the compartment 2 on this side and compartment 3 on this side. And if you keep on palpating towards the ulnar side, you will be ending up in the ulnar styloid process. Fine. Then comes, because we are the frequency. So since we are scanning very superficial, so I'm using a frequency of 20 megahertz. And I'm going for a linear probe. So what we have learned is, if you really want to scan the dorsal compartment of the wrist, the first step is to identify the Lister tubercle. Now, Lister tubercle, we have seen how easily we can identify just with the palpation thing. So if I go from the styloid process and if I'm coming there, this is the bumpy thing which I'm able to feel. So I will put my probe in the short axis to the distal end of the radius with the aspect marker towards the ulnar side, and I'll just keep my probe there. So the moment I have kept my probe there, so let me just increase the gain a bit. Okay, so the moment I have kept my probe there, I'm able to see the bumpy thing which we have identified by palpating, and it has got one limb this side and one limb on this side. So this is your Lister tubercle. And now you know that Lister tubercle is the one which will be separating the compartment 2 from the compartment 3. And do remember Lister tubercle like an inverted V-shaped structure, or you can just remember it like, one mountain kind of a thing. So one limb of it, you're going to have the second compartment, and on the other limb, you're going to have the third compartment. So once you identify this lister tubercle, I always say this as my home page, because if I'm lost somewhere, I will come to this point and I'll scan again. So if you are going towards this side, right? So this is going to be your radial side. And if I'm moving my probe towards this side, this is going to be my ulnar side. This is how exactly I have kept the, the wrist joint. Fine. So this is your radial side. Again, I'm repeating, this is ulnar side. Now this is the lister tubercle, which is in hyperechoic structure, which is casting an acoustic shadow. And this is the one limb, this is the other limb. Now this is what we are basically seeing is the dorsal aspect of the distal radius. Same here, which we are seeing this side, and then there is a gap, and then there is again bone. So this is your ulna, which is starting up, and the gap which you are seeing here, that is the distal radio-ulnar joint. And I should say, to be more precise, it is dorsal distal radio-ulnar joint, because there is a gap between these two. So that is all about the bony things. And now we will be just going to identify the structures one by one. So again, my probe is in short axis, okay, over the, I should say, the lister tubercle. And if I'm going to this side, now I'm able to identify the two tendons. So how I have moved from the lister tubercle, I am going towards the radial side, right? So the first tendon which you will be seeing here is going to be your Extensor Carpi Radialis Brevis. And this tendon is going to be your Extensor Carpi Radialis Longus. So ECRB and ECRL, the moment you have moved from the lister tubercle and you are sliding your probe towards the radial side, you will be able to see two tendons. These are the tendons of the second compartment. So the which is lying closer to the lister tubercle is your ECRB, and the other one is your ECRL. So these two tendons are the tendons of the second compartment. So again, we'll go back to our home page. So home page, when I say, that is the probe is in short axis to the distal dorsal aspect of the radius with the aspect marker towards the ulnar side. So now that is the lister tubercle. Fine. We have already seen these two tendons, means I have just scanned the second compartment. Now, if I have to go and if I want to scan the first compartment, what am I supposed to do is I'm supposed to slide my probe towards the radial side. Fine. So if I will be sliding my probe like this, then I will be just reaching to the first compartment. So that is one way. We do have another way of examining the first compartment, which I'll be showing you in a while. So now we are seeing again two tendons here, right? So this tendon is going to be your Extensor Pollicis Brevis, and this is your Abductor Pollicis Longus. So again, if you go back to the anatomy and if you'll see, we have a longus which is followed by a brevis. This is how we remember, and A is for the alien, which I have already taught you. So Abductor Pollicis Longus, Extensor Pollicis Brevis. Pollicis is for the thumb. So these two, they are basically the tendons which will be going for your thumb. And on this side, you will be able to see the radial vessels. So that was about the first compartment, which you identify if you are moving from the lister tubercle, you are identifying the second compartment, and then you are going to the first compartment. So this is one way. And another way is you can just keep the forearm in the mid-prone position, right? And you will just palpate the radial styloid process. So you know that this is the dip. So above that is going to be the radial styloid process. And then you can put your probe exactly in the short axis over the radial styloid process. And in that condition also, you will be able to see the tendons of the first compartment in the short axis. And do remember what we have learned about the tendons, that the tendons in your short axis, they will be hyperechoic, clustered dot-like appearance. So again, the same thing which we have seen when we followed it from the listed tubercle, identifying the second compartment and then going to the first compartment. But here what we are doing is we have changed the position of the forearm. We have just brought it to the mid prone position, and then we have identified the radial styloid process. Then we have put our probe in the short axis over the radial styloid process, and now again we will be able to identify these two tendons. So this will be your Extensor Pollicis Brevis, and this is going to be your Abductor Pollicis Longus. Fine. So that is the another way of identifying the tendons of the first compartment. Now moving to the again our home page, and then identifying the third compartment, the fourth compartment, fifth and the sixth compartment. So again we will go back to our home position. So home position is always elbow in extended, forearm pronated, and palm which is resting on the table, with your probe in short axis to the distal end of the radius, the dorsal side, because we are looking for the dorsal side, and the aspect marker towards the ulnar side. So if you are again going to identify the third compartment, we'll go back to our listed tubercle. So again, I'll put my probe over the listed tubercle. The moment I will do so, then you will be able to see structures like this. Okay, so this was a listed tubercle. We have identified the second compartment. Now, if I'm going towards this, you will be able to see one tendon which will be lying just adjacent to the listed tubercle. So this is your Extensor Pollicis Longus, and this was your ECRB. Again, a longus followed by a brevis. And when you come here and you are able to see here, that is your fourth compartment. That is Extensor Digitorum along with your Extensor Indices. Now this was the bone, and this is again another bone, but there is no continuity in it. There is a gap, right? So that is, again I'm repeating, it is the dorsal radio-ulnar joint, the distal radio-ulnar joint, and you can very well see the hyaline cartilage which is present over the ulna, the distal ulna. Okay. So once we have identified now the compartment 3, the compartment 4, so now we will be identifying the compartment 5th. Again, probe is in short axis over the distal radius, the dorsal radius, distal dorsal radius, I should say, to be more precise. And we will identify the listed tubercle. Now we have identified the third compartment. And as you can see, if I'm just toggling my probe, right, like this, the tendons are becoming the tendons are just, becoming hyperechoic, and now they're just looking hypoechoic to me. So this is because of the anisotropy. When your beam is perpendicular to the structure of your interest, you will be able to see them nicely. And if not, then you will be just seeing them as an hypoechoic structure. Now, if I move to this side, right, and if I will toggle my probe, right, so you are, okay, let me just apply some jelly. Fine. So if I'm coming over this joint, and if I'm toggling my probe like this, you must be able to identify one tendon which is just, getting black. And then when I'm toggling my probe, it is becoming, again, hyperechoic. So that is your 5th compartment. Now, 5th compartment has got Extensor Digiti Minimi. Okay. Again, we will see this. So that was the listed tubercle. This is the third compartment, Extensor Pollicis Brevis. If I have slided my probe to this side, now you will be seeing the 4th compartment, right? The Extensor Digitorum along with the Extensor Indices. And if I am moving, to this side, then you are able to see one tendon which is here, right? So that is your Extensor Digiti Minimi, and This is the one which will be lying in close approximation with your distal dorsal radio ulnar joint. Now, if either you move again to identify the sixth compartment, either you can move, your probe towards the ulnar side, and you will be able to identify the sixth compartment. So let me apply some jelly so that I can show you it in a proper manner. Okay, so we were here, right? We identify the third compartment, we identify the fourth compartment, and then the fifth compartment, and then now we are heading towards the sixth compartment. Okay, so what you are seeing here right now is the ECU. Now this is Extensor Carpi Ulnaris. That is sixth compartment, right? So either you can identify it in this manner, that you are sliding your probe like from your home position towards the ulnar side, identifying each compartment and then going to the sixth compartment, or you can identify it by identifying the muscle, which later on becomes the tendon, which I'll be showing you. So for that, again, you will put your probe in the short axis now to the distal ulna. Okay. And okay, let me. And then you identify the ECU, right? The muscle which you are seeing just beneath the center of this is your ECU. You keep on following it. So you keep on following this muscle. Okay. You will see that it becomes a tendon. You keep on following it. And then you will see this is what you are seeing as the sixth compartment. So that is another way of identifying that you follow the muscle from the proximal, and then this muscle becomes the tendon, and you follow till it becomes the tendinous and it lies in a groove, which is there on the ulna, right? So this is how you identify all the six compartments of your dorsal rest. I hope you enjoyed this video, and thank you so much for watching. And do join us, do join our channel to watch some more interesting videos like this. Thank you so much.